everyone. Welcome to PHAMCAST. I gotta tell you, I am super excited about today's show because we have a returning guest, a PHAMbassador, Dr. Stephen Rallis, who's back in the house, and he's back due to popular demand. Let's be honest. We had an amazing conversation on the last time he was here, and now he is back. But we're doing something kind of cool today that we've never done before on PHAMCAST. We're doing sort of a rapid fire questions because inquiring minds want to know. Dr. Rallis has an incredible wealth of knowledge. Not only is he a chiropractor and a naturopath, he's the chief medical officer of DripBar Canada. He's leading the charge in IV therapy across North America, and he has an incredible clinic in Barrie, Ontario that's doing amazing things. And of course, he is a PHAMbassador, but most importantly, he's a good human, and he really believes in educating and empowering. And that's why the rapid fire is going to be fun. Dr. Rallis, thanks for coming back.
Mark, thanks for having me. This was awesome. It was awesome last time. It's going to be awesome this time. And I can't wait. We got so many great questions.
We did.
That I can't wait to actually just dive into them. And some I do know. Some I actually just did a very cursory sort of review, partly because I wanted to answer them off the cuff.
I love that. I love that. And yes, and being authentic and honest and what's in your head at the time, that's what we do day to day as professionals, as healthcare professionals. And I love that we're going to, and we don't want to do this too fast so you feel like, oh my goodness, but we do want to get through so many of the questions. But here's the good news. If we don't get through everything, or if your question, you have a burning question that you didn't have answered on this show, send us a message, send us a DM, drop an email, whatever you want to do so that we can continue this conversation, if not in studio, online. So are you ready to get started?
Let's go.
Rapid fire. Okay, I got to put my glasses on so that I can read. So what I kind of did was divide this into some different sort of topics. And the first sort of whole topic, which I think is important, is integrative health, which is what this whole mission of PHAM is about, is breaking down silos and bringing integrative healthcare professionals together to learn and grow from one another and to stock your toolbox. So the very first question was, what's one integrative therapy you think more people should know about?
Easy. Answer to that one is IV therapy.
Yep.
And vitamin IV therapy is so misunderstood, partly because we use it in hospitals in acute scenarios where you're using saline or lactated ringers, or you're using it as a vehicle to give a drug. But understanding how vitamins are infused and the impact that they have is completely different. It's a very novel science. And one of the privileges I have is being on the scientific advisory board for the American IV Association. And we write policy papers for pharmacy boards, nursing boards, medical boards, and the amount of misinformation is really astronomical. I'll give you a good example. I had a patient with colitis, which is an inflammatory bowel issue, and she hadn't had a solid bowel movement in over a year. Oh. She came to our clinic. Really, the standard of care for that is prednisone. Issue with prednisone is it only works for so long. We did an infusion with vitamin C. We put magnesium, I think it was magnesium, the formula was magnesium, calcium, zinc, vitamin C. I think we did glutathione as a push, basically to support the antioxidant membrane, but also the enterocytes, which are those cells lining the GI tract. She had her first solid bowel movement that night. Now, interestingly, had we used vitamin C orally, not only at that dose would it not have worked, it would have made her condition worse.
Right.
Because it's an osmotic laxative, like you know.
Yes.
So how did that happen? How is it possible that we can infuse IV vitamin C in a patient with colitis, and their colitis essentially began, that transition, the healing mechanism, that innate healing mechanism began to get turned on? Because IV vitamin therapy is just completely different.
Right.
And that is one integrative therapy people really need to know more about.
And you know what? Speaking of colitis, so I don't know if you know my story about infectious colitis and almost dying from hospital-borne infection, C. difficile. And I'm one of the first people in Canada to have a successful fecal transplant. When my son was 12 years old, he was my donor. And I was very sick. And and on high doses of vancomycin and antibiotics and had lost 30 pounds and running to the bathroom 50 times a day. So you can only imagine I felt like a wet noodle and literally on death's door in hospital many times. Had I known, and actually I did, but my son is now almost 30, so he was 12. Things have come a long way. That could have tremendously expedited my healing that I suffered through for many,
massively.
many.
Not only that, but with the antibiotics, you can use a lot of these therapies, like high-dose vitamin C, and not high-dose vitamin C that we would use, the doses we would use in cancer, but slightly sub-therapeutic to cancer doses. It's an incredible adjunct to antibiotics. And you'll see patients with sepsis, and once they start the IV vitamin C, instantly you see that transition, the turn, and again was used during COVID in some hospitals. I had volunteered actually our clinic during COVID to be used as a triage center and to also use IV vitamin C during COVID. RVH didn't take me up on it. And I think it's for obvious reasons. They're just, this medicine is really so poorly misunderstood that they felt hamstrung just really from lack of knowledge. Which is unfortunate, and that's part of what this whole exercise is for. We're here, as much as we love each other, right?
Oh, we're here to educate.
We're here to educate.
Not just everyday people, but to also educate
100%.
Our colleagues in healthcare and to bring validity, because it's there, so that people understand. Because I suffered for the better part of 30 weeks, and I know it could have been different. And it was my naturopath, actually, to her credit, that got my gut biome back on track, and that has allowed me to be here living. But I know what not having a good gut biome after weeks and weeks and weeks of vancomycin, I was very sick. So that's really important. And I've got to put a plug in.
And I'm actually going to give you a great tidbit, because I know you were talking about the mental health earlier.
Yes, we were.
First-line therapy for anxiety, depression is a selective serotonin reuptake inhibitor across the board, across the world. Yet most people, and I could argue probably even most doctors, don't know that serotonin's primary role is to move your bowels. That's serotonin's primary role. In other words, if a patient is naturally low in serotonin, they will have sluggish bowels. They'll typically be an undermethylator, so they'll be more susceptible to constipation. If they have high serotonin, they have rapid bowels, because serotonin's job is to move your bowels. So when that patient with rapid bowel movement is given an SSRI, what ends up happening is they actually end up becoming psychotic. And you see that over and over.
And that's the warnings on those medications.
Right, and it's not, and the warning wasn't that the medication didn't work.
No.
It worked. It was that patient wasn't screened. And from a functional medicine perspective, it was never checked. And no one even bothers to ask, what are your bowel movements like? And second would be low serotonin, or would be an undermethylator. They would have high histamine. They would also have seasonal allergies. So anyway, I wanted to share that, because that gut-brain, it's not that this is some sort of ethereal, mythological connection between our brain and our gut. It's happening in real time. The serotonin is primarily here. And it's circulating everywhere else. It's not the other way around, and that's why we have gut instincts. That's why we feel it first here. That's why anxiety is felt first here. And spending our time doing cognitive therapy is not bad. It's a physiological phenomenon. And unless you unwind that first, you're never ever going to get to the anxiety or the depression.
That's integrative health.
That's integrative health.
Love that. Love that. Okay, because we've got so much to cover. We're going to move on to the next one. How do you combine, I love this question, I know the person that asked it, how do you combine naturopathic and chiropractic care into your practice?
It's impossible not to. Chiropractic is a portal of entry primary care profession with an emphasis on musculoskeletal issues. And neuromusculoskeletal issues, really. But you know, in the 1990s, there was this tremendous paper that was written out about the therapeutic order, which is really a mechanism of healing. It was written by two naturopathic physicians. And it sort of laid the groundwork for healing as a mechanism. The first in that step is basically to remove obstacles to cure. Further up the line is, supporting the innate healing mechanisms in the body, but one is correct structural integrity. And really the idea of what I loved and love about chiropractic is it's a hands-on profession. It's also it's deeply entrenched as a functional medicine perspective as well. So when you look at a person's issue, it could be fascia, it could be the joint, it could be the muscles, it could be the chain, it could be how they're walking. And chiropractors are so intrinsically interested in lifestyle medicine,
Yes.
in nutrition,
Yep.
in habits. Some of the best primary care doctors are chiropractors because of how they view their patients.
Right.
They're looking in terms, they're measuring health in terms of wellness. Adding naturopathic was really easy. It was just an expansion of scope for me.
Right.
It wasn't, there was no, how you integrated. I know that there was a question between how do you choose between conventional and
complementary.
So I'll take a patient. My wife suffers with migraines. So I have, as a consequence, become an expert in migraines and have treated many patients over the years with migraines. And a migraine could have a musculoskeletal component. So there's usually a cervicogenic component. Usually C1 atlas is out.
Yep.
Sometimes it's C2, C3, but it's almost always a cervicogenic component. Even though it's not a cervicogenic headache, which people confuse. Migraine presents as a headache. Migraine is a neurological condition.
Correct.
So there's big confusion. People that don't know will say, oh, it's just headaches. No, it's not headaches. It's neurological. But then there's an intrinsic component. In other words, how the gut affects migraines. So gluten typically affects migraines. Gliadins can affect migraines. Anything that drives IgGs or immunoglobulins will affect migraines. Anything that affects histamine.
Stop there, because people at home, I understand what you're saying. What would affect that? What is that? Because people won't know.
So essentially that neurological mechanism that happens in migraines is close to threshold.
Yep.
So anything that tips it over, it can be stressed.
What's going to tip it?
Let's say high histamine. So let's say histamine levels are higher typically in a migraine patient.
Yep.
So if they have a high histamine food, which could be as easy as smoked meats and cheese and red wine.
Exactly. Okay.
And boom, they have a migraine. And why do they have migraine? If they had smoked meat, cheese, red wine, and had migraine, already they're high histamine.
There we go.
So then you would begin to down-regulate the histamine. So you could use vitamin C. You could use anything like that down-regulates that. Quercetin down-regulates histamine. DAO, as an enzyme, down-regulates histamine.
Okay.
B6, zinc, magnesium down-regulate histamine. There's a muscular component. And in terms of conventional medicine, everyone needs a rescue remedy. And there's some great ones. Triptans, as an example. Patients should not be suffering for 3 days in a dark room with a migraine. If they could take a triptan, and boom, that migraine is mitigated. They're not perfect, but it's better.
Yeah.
Right? So again, that's how you would marry conventional and complementary. You want to clear that structural integrity. You want to make sure you remove all of those components, and then you want to down-regulate those precursors that drive the migraines. And what we see over and over again is the migraine patient that was having 28 or 25 or 20 migraines in a month is now having 3 or 4.
Talk about quality of life change.
It's
remarkable, right?
Yeah.
How rewarding is that?
Yeah, and you see it over and over.
Yeah.
It's very rare.
Yeah.
It's very rare that it's one thing, like one adjustment, or just one drug, or one supplement.
Exactly.
And again, that's the idea of what integrative therapy is. It's not just one thing. It's looking at a problem, a complex problem.
Yes.
From all of these facets.
Yes.
And the more you practice, the more complexities you see.
Yes, and from the patient side, we also have to work on that mindset, because unfortunately, the system that everybody has existed in for the last 40 plus years, they're looking for that one silver bullet, quick fix, answer. And that is not the way things work. So I think it's really important, and this is why we have these conversations, so people can realize, oh, wait a minute, there's all these other options that I could be looking at. This didn't work, but that doesn't mean there's nothing else there for me. And it's not the physician's fault either, because that's not their training. We got to make sure we're going to remind ourselves in our last segment to talk about a board that we're both on, a new medical school that we're on the advisory board for the curriculum, because I think, the future is bright when it comes to changing the way we look at healthcare.
Yeah, future's changing.
It's changing, and that's really cool. Okay, so.
Right, and the system doesn't reward.
No.
So the family doctor's there with a patient with a chronic condition, a chronic complex condition.
Yes.
And they're being told, instructed, it's one concern.
Yes.
Okay,
Yes.
good luck.
Right.
Right. Good luck. Okay, one concern. You've got one concern.
And you have 5 minutes.
So the patient leaves dissatisfied.
Yes.
The concern is never really addressed.
Yep.
All you can really do is triage emergencies.
Yes. Yes.
Anyway.
Yeah. Oh, I mean, we could have an entire show just on that. So one of the, which we just addressed, what role does mindset play in integrative health? We just addressed that. How do you decide, conventional, we've already addressed that. And are supplements always necessary if someone eats well? This one, actually, I had 3 different people send me this question. What do you say, Dr. Rallis?
Are supplements always necessary?
If you eat well.
If you eat well. I thought about this, in terms of quality of life, length of life. Medicines, which, when we talk about supplements, first there's a confusion. So let me just sort of clarify. You could have nutritional supplements,
Yep.
which could have a combination of nutrients, vitamins, cofactors, minerals, like zinc, right, or CoQ10, magnesium. You can have botanical medicines, hydrastis, golden seal, etc. You can have ginger root, etc. And I think that when you look at supplements, first of all, every culture, in terms of cuisine, uses botanical medicine.
Yes.
In heavy amounts. Mm-hmm. The first thing that sort of jumped into my mind was that the 3 wise men brought baby Jesus, gold, frankincense, and myrrh.
Right.
So essentially 2 botanicals.
Yep.
So the first presents were 2 botanical supplements. And we've been using supplements in botanical medicine in every culture that cooks. Like when you look at a Mediterranean cuisine, from the mint to the oregano to the olive oil to the, the list, the cloves, the list is endless. Indian cuisine, indigenous cuisines, all cuisines use botanical medicines in high amounts. So they are supplementing. So are supplements necessary? The answer is yes. If you're eating pablum, which is the normal North American diet, then the answer would be yes for sure. If you're cooking in a way that includes a lot of these botanicals that provide medicinal healing, then less so.
Right.
Our foods are deficient in most nutrients.
And I think that's really important to say, because it is,
so
even if you're cooking from scratch at home, our food's supply chain is not what it used to be, for many reasons.
I couldn't imagine not using supplements, I'll say that. Mm-hmm. And I think everybody, almost everyone would benefit from supplements, but really cuisine is not, and food as medicine, if you will,
Absolutely.
is not really properly constructed with enough botanical medicines.
Love that. Okay, so we just got through the first bit of our rapid fire, and we're going to take a break, but we're going to be back with so much more to stock your toolbox and really to just empower you to feel like you're in the driver's seat of your health, because here's the thing, you are. We'll be right back.